everybody. We are the UNC and CORE team. Our topic is Reducing Stigma, Saving Lives, a community-based program to build awareness and treatment for those with opioid use disorder.
Our team members are Ms. Linda Maynor, Oxendine, and Rubalena Locklear, representing CORE. And from UNC School of Medicine, we have Dr. Robyn Jordan and Sy'Keria Garrison.
Our pitch for our program is to reduce stigma around opioid use disorder for residents of Robeson County through education and training. Our partnership of academia and community is going to allow us to speak to our strengths and provide a twofold approach. That twofold approach is to educate the community about stigma and naloxone training and to train providers in the workforce on evidence-based practices for treating OUD. So by educating the community, we want to accomplish coupling leaders in the community as trainers with local people with lived experience as speakers. This is a train the trainer model that we're incorporating here. And by the end of this project, we anticipate a culture shift in this county such that community members are more knowledgeable about naloxone administration and they're more accepting of treating addiction.
Here you have our Indigenous Communication Path image. We took a holistic approach with community engagement, which was our harm reduction, naloxone distribution, our connected care, our physician training, and naloxone and stigma trainings.
So on our story reflection, showing the impact of our program, we're going to begin with recruitment. We want to get participants through word of mouth, community events, and advertisements. Then we want to do a pre-survey because we want to measure exactly where these individuals are before the training occurs. Then we're going to hold a training that's going to last about an hour and a half. And this training is going to teach on the subject matters around addiction. So speakers in recovery will also be on site to provide their lived experience. And then after we complete that training, we're going to do a post survey because now we want to see where the participants are in their learning after they have been trained. And then about 6 months later, we're going to conduct a follow-up survey. And this is going to see if anything that they have learned has been applied.
This is our infographic. We pride ourselves on having 2,500 plus individuals trained in naloxone and stigma. Those trainings are continuing through the end of December, so that number will continue to increase. We were able to do physicians trainings, peer-to-peer recovery speakers, connected care, again with that holistic approach, including treatment, transportation, food, identification, housing, and substance use disorders.
So for our naloxone trainings, we have some metrics from these trainings. What we first see that was our demographics for the people that we trained. These people are from various different racial backgrounds, with Native Americans and African Americans being our largest populations. Also for our pre-survey questions, we found that the training was unlike anything that participants had ever done before. And it was their first time receiving education on signs of overdose and naloxone. Additionally, many of the participants said that they had not used naloxone on another person in the last year. They do not have naloxone in the home. And if they do use drugs, that they do not have naloxone during drug use. Also, some additional impact metrics from our naloxone surveys showed that for the participants that were able to go to these trainings, that they said they will change their behavior due to what they learned in the trainings. We also received many positive testimonials, like participants saying that they'll purchase Narcan so they can be prepared for a situation if needed. They'll also change the way that they treat people that are struggling with addiction. And even one person saying that they work with someone who has substance use disorder and will provide this information to them. Also, with our pre to post surveys, we showed that participants learned a lot about different signs of opioid overdose here, as well as what should be done when managing an opioid overdose, what naloxone is used for, how naloxone can be administered, the recommended places to administer naloxone, and how long naloxone takes to start having an effect after administration. And we saw that many of our participants that didn't know the answers pre-survey could then identify correct answers post. Also, for our physician trainings, we saw that we were able to get metrics from a variety of different healthcare providers, with 5 providers being advanced practice providers, 2 being pharmacists, and 2 being social workers. We also were able to gauge the providers' viewpoints on different questions related to if addiction is a chronic disease, if it's difficult to find a pharmacy to fill buprenorphine prescriptions, also if they believe that people of all races have access, if their practice is supportive of OUD, if they're confident in diagnosing OUD, if they're confident in treating OUD, and if they're familiar with different formulations of buprenorphine.
My takeaways and reflections for the project was, having speakers made it more, the training is more personal. The audience could relate to the individuals, instilling hope that recovery is possible, that can lead over to their family members who are facing the struggle as well. For personal development, I was presented the opportunity to explore and realign my own stigma about addiction and harm reduction practice, and fine tune my leadership qualities and strengthen my skills as a speaker. Applying what I learned. Always, we want to lead the community better than we found it through a community-based participatory approach, and it allowed us to do naloxone stigma trainings in the community and equip the community members with a life-saving naloxone. This project taught us how to be pioneers in harm reduction in our community and leave it healthier than we found it.
So as we strengthen our leadership abilities, we are now able to empower those in our community to be leaders, which is extremely important to us. Again, we wanted to use the train to train the model so that we could really spread the information that had been learned through the community as quickly as possible to help reduce the risk of those in active addiction. So as you saw from the data that was presented earlier, we have learned that a greater understanding about addiction has occurred, a greater understanding about identifying an overdose, and how to reverse an overdose using naloxone. All this was very important to us. So the greater understanding of the community, to have this connection to those working in higher education about opioid overdose, was very helpful to me because it helped me see what happened on the academia side, and it also helped the academia side what's really happening out in the community. So as community members, we can add, or we can actually become those trusted messengers of the wants of the community needs. Whatever the community needs, they know that they can turn to us, that we are trusted, and that we're there to help reduce their risk and reduce their harm in an active addiction situation. So learning about addiction from partners with a strong background in addiction medicine leaves us speechless because it was priceless.
Dr. Jordan's leadership takeaways and reflections were for the project that she found that it's important to listen to the community's needs, and that really fosters trust and it builds relationships. Also, that outcomes can improve when we listen to what the community tells us. And for the WCC personal development, she found that paying attention to each individual's skill sets and leadership style can enhance communication. And overall, applying what she learns is that effective implementation requires flexibility and changing course when needed. My leadership takeaways and reflections were that I had the amazing opportunity to meet and work with a group of very extraordinary people. I've been able to meet and work with 3 of my amazing team members, Dr. Jordan, Linda, and Ruby, and also other people who have been involved in our project. And this truly was a pleasure, and I was so grateful to be a part of this group. Also, I learned so much about opioids, addiction, stigma, and naloxone. As a graduate student who conducts research, I feel this project really opened my eyes on how research that I conduct in a lab can actually be translated into the real world to help people. I learned a lot about opioids, addiction, stigma, and the naloxone during the project. And it really could spark conversations that I would have with friends and family about this project. So now I am also a naloxone carrier, and now I can do my part in reducing opioid harm. For WCC personal development, I got a amazing toolkit of how I could be a good member of a team and how I can apply these things when it is my turn to step up and lead in teams. I also had some favorite workshops, including the Myers-Briggs and the Change Style Indicator. And overall, what I learned from my part in this project is that how I can be the best team member that I can in the teams I'm involved with. Currently, I am someone who works with undergraduate students, and I feel like now I can be a better leader in the teams I'm working with, and also how I can lead teams in my future career. So overall, this was an amazing experience, and I am very grateful to have been fortunate to participate in this project and the trainings through WCC. So future directions and next steps for the projects are to use the data that we received from these projects and these surveys to enhance future programs. Also for the physician trainings, these were trainings for healthcare providers in Robeson County on how to treat those who have opioid use disorder, overall to reduce opioid stigma amongst providers and reduce barriers to care. And then for the Atlas Mobile Treatment Unit, that was a treatment unit that provided OUD treatment to community members in need. And this was a place that could foster a community and those that were participating, as well as provide support and help those that are participating get their lives back on track. So overall, this project really shows us that knowledge is power, and we plan to continue empowering the community to change attitudes around opioids and naloxone. So thank you to WCC for the opportunity. And here is a short clip from Dr. Robyn Jordan about the project. Okay. Thank you so much.
Thank you, everybody. Thank you for the opportunity.
Hey, everyone, we appreciate it.
Thank you.
Come in and they feel shame, they feel like they're not going to be judged, not going to be punished, you know, all this. Oh, it's been fantastic. So we come out every week on Wednesdays and bring addiction treatment into the community, but there's only so much we can do. We're not from the community, so we can come here and bring medication management, but what CORE brings is that other element, all the social work services, connection to treatment, resources. So it's been a great partnership to be able to have all those elements together.
Protocol. So the buprenorphine on the top, that part just doesn't change. That's just what you do, and it just works. We started doing this protocol in 2020.
We're doing the physician training once a month, and we've got a group of people that come, and they're learning to work together and learn from each other. So it's building that network so that when they have questions, they have learned how to ask each other and learn how to work together in that. So I think it's really important. And every community is a little bit different, so being able to provide that training here for the community that's specific to here, I think is really important. We set up at the DSS parking lot every Wednesday. It's a little bit of everything. So CORE refers people to us. We get some referrals from the hospital. DSS will refer people to us, but the most referrals we get are from our own patients. So people that have come out there bring their friends, their family, and that's the majority of our referrals. Our goal is to understand what the community's needs are and to meet those needs. So we've been more focused on learning from the community so we can train the providers rather than trying to see as many patients as possible.